The gentlelady from Florida, Ms. Wasserman Schultz, is recognized for 5 minutes.
Thank you, Madam Chair. Dr. Redfield, yesterday my colleague, Mr. Raskin, asked you about a nurse in California who was quarantined after treating a patient with coronavirus and showing symptoms of the disease herself. She couldn't get tested, if you recall, even though her local public health department recommended one. She said this, and I quote, "The public county officer called me and verified my symptoms and agreed with testing, but the national CDC would not initiate testing. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus." Dr. Redfield, when you were asked about this yesterday, you said this, and I quote, "This is a misunderstanding if it did occur." You testified that, quote, "The test was always available in Atlanta, where CDC is located. If you sent the sample to us and there was never a time when a health department could not get a test, they had to send it to Atlanta." You claimed that CDC's testing criteria never placed restrictions on who got tested, rather that was only guidance, and, quote, "We always left the discretion to do testing to the local public health group." So the committee staff reached out to National Nurses United, the union representing this nurse who was not able to receive a test. And they sent us the following statement last night. And Madam Chair, I ask unanimous consent that this statement be entered into the record.
So granted.
According to National Nurses United, in recent weeks, our union has been made aware of multiple circumstances, and the statement is up on the screen, multiple circumstances in which healthcare workers have been exposed to COVID-19 infection and have not received COVID-19 tests despite requests for testing. They continue. There have been too many cases where exposed healthcare workers have been refused testing for this to be considered a misunderstanding. Further, members of our union across the country have reported countless cases in which testing has been refused to patients when clinicians have recommended it. Dr. Redfield, the national union that represents nurses across this country just issued a statement publicly contradicting your testimony yesterday before this committee. So I ask this question: will you admit that there is a serious problem in this country with individuals, even healthcare workers, obtaining access to testing for coronavirus? You have to turn your mic on.
Thank you for your question, Congresswoman.
You're welcome.
I'm going to be looking into this in depth, as I said yesterday. Clearly, we need to protect the healthcare workers on the front lines. In general, these are local decisions on which healthcare workers need to be tested and exposed by
Okay, but these are workers, these are people who contacted CDC, and it's CDC that they say turned them down and said that they couldn't be tested.
And I will look into that in detail and get back to your office as soon as I can.
Well, as soon as you can, hopefully will be today. There are countless more examples of problems with people getting access to tests all across the country, including in my home state of Florida. We need to have someone in charge of making sure that as many people as possible across this country have access to getting tested as soon as possible. Who is that person? Is it you? Is it the Vice President? Can you give us the name of who can guarantee that anyone, but especially healthcare workers who need to be tested, can be?
As I tried to explain to Congressman Green, from the CDC perspective.
Okay, I'm asking for a name. Who is in charge of making sure that people who need to get tested, who are indicated to be tested, can get a test? Who?
Yeah, I was trying to say that the responsibility that I have at CDC is make sure all the public health labs have it, and they can make the judgment on how they want to use it.
But they're referencing people who have been advised to be tested to you, and they've been turned down. So is it you?
As I said, I'm going to look into the specifics.
I know that.
There.
So basically you're saying, reclaiming my time, basically you seem to be saying, because you can't name anyone specifically, that there's no one specifically in charge that we can count on to make sure that people who need to be tested, healthcare workers or anyone else, there's not one person that can ensure that these tests can be administered. Yes or no?
My colleague is looking at me to answer. Here we go.
Okay.
All right. So,
and I do have another question, so if we can kind of get
so very quickly, the system is not really geared to what we need right now, what you are asking for. That is a failing.
And failing, yes.
It is a failing. I mean, let's admit it. The fact is, the way the system was set up is that the public health component that Dr. Redfield was talking about was a system where you put it out there in the public and a physician asks for it and you get it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
Okay, that's really disturbing, and I appreciate the information.